Thanks, Sue, and I hope everyone is now refreshed and ready for another very, very interesting session. So we're going to start with a presentation from Ollie Coburn, and Ollie's going to talk about the role of private practitioners in community MSK Health. And Ollie is the Registrar and policy-based lead for the British Association of Sport Rehabilitators, BASRaT. BASRaT, much easier to say than the whole title. And Ollie is an advocate for, in general, for the profession of sport rehabilitation. He's also a passionate advocate for the role of all MSK clinicians in the independent sector and how they can contribute to population health. So Ollie's going to do a presentation again. We won't have very much time for questions, but do put any that you have in the Q&A box. Okay.
Quick question, can you see my slides okay?
Yeah, we can see them.
Perfect. Great stuff. Hello, everybody. Welcome to the afternoon session. Thank you for joining us. Thank you to Sue and to ARMA for the invitation to speak. Greatly privileged to be amongst the rest of the speaker lineup. I do hope, as per the title, this session inspires you to think differently and also challenges some of the opinions that you may already hold and sparks some discussion. That is my intention. Throughout the presentation, I've used the narrative of private practice, but of course I refer to the independent sector more widely. I'm aware that the word private carries with it some connotations, but there are also some fantastic organisations such as social enterprises in the independent sector that aren't consistent with those connotations. I will be presenting a non-partisan view, not just that of my profession, and I've had some wonderful input from colleagues across the private sector, and I will represent everybody's views equally, even those that I would like to challenge myself. I'm conscious that we've got a very varied audience, and so I've tried to keep jargon to a limit. If there is any sort of jargon that I use that you would like me to clarify, please just let me know in the chat and I'll be more than happy to do so. I also apologise for the slightly busy slides. As we've mentioned already, this is a shorter presentation, so I have only 20 minutes to take on this topic, and I will do my best to squeeze everything in. Nevertheless, there may be some information on the slides that I don't cover, and I do hope you will catch up on that in the recording. So, because we've got limited time, I'm going to begin with the end in mind, and this is one of two key messages that I'd like people to take away from the presentation today. And that is that to be truly patient-centred, all strategies and policies should be co-produced and take a system-wide approach. The current system of MSK provision is an unchangeable reality, and therefore to elevate both sectors to the heights we all aspire to, we must accept that reality and do our best to work together, because ultimately that will benefit patients. And you'll hear me say that a lot. Very patient-focused in this presentation. Who am I? My name's Ollie Coburn. I'm the Registrar for BASRaT. My role is concerned with governance, policy and fitness to practice. I do also still do some independent sector work in private practice, and I'm also the MD of a social enterprise that offers free access to MSK services. We're going to talk about what private practice does brilliantly, some of the challenges that it faces, and most importantly, some of the solutions for how we can work better together. I'm not going to turn up and just moan for 20 minutes. I want to be solutions focused. So what do we do really well? Of course, we're a primary point of contact for members of the public. Many people self-refer themselves to private practice, have appropriate assessment, diagnosis, treatment and discharge in the private sector without the need for any primary or secondary care from the NHS. That's obviously wonderful for patients in terms of speedy access to a resolution of their symptoms, but also for alleviating the pressure on the NHS, particularly that which we're facing post-pandemic, or still in the midst of a pandemic as it is. We also have the ability to be extremely patient-centred like everybody else, but without the constraints that might exist of a pathway or system that we work within. And the primary example of that is the point at which patients may be discharged from our service, and our ability to tailor that really closely and in alignment with their own goals and expectations. The obvious example is somebody that's very sporty or involved in another high demand activity that requires returning to a very high level of function. We also offer excellent patient choice not just in terms of profession, therapy, or intervention, but also in terms of location and type of facility, and indeed the choice of individual. Okay, we know that's really, really important for being able to build a good therapeutic alliance and get good outcomes. We know that in that regard, patient choice, agency is really high. So the public perceive their ability to choose a practitioner as being very good. And we also know the primary driver for finding that practitioner is not through professional bodies or regulators or registers. It's through family and friend recommendation. Now that does carry with it some challenges, and we'll address that in solutions. But we know that agency is high and choice is, of course, important. What else does private practice do really well? Well, the obvious one is accessibility. We're often based in local communities, close to people's homes, or in facilities that they would otherwise be visiting already. An example near me, I can walk to a physio, a sport rehabilitator, and a podiatrist within 2 minutes. Yet my closest secondary care MSK service is 2 bus rides away. So accessibility is important. You also have home visits being widely available, and the speed and ease with which patients can schedule those appointments being really easy, which is great for early intervention and spotting serious pathology early. Facilities are also a kind of really important point with private practice. Excellent facilities, particularly those based within other alternative settings like leisure centres, where we have commercial level gym equipment, swimming pools, and various other things consistent with contemporary MSK practice, where we can get people moving and get people stronger. And we have access to those in the communities that people are in. And of course, expertise. So many private practitioners, if they don't work concurrently in private practice and the public sector at the same time, will have probably done so previously and worked in many other roles that they bring that expertise with them. I would, of course, just like to acknowledge as well the role of private practice during COVID-19 in 2 regards. One, for those that were able to work in the middle of the pandemic, but stepped up to offer their services to the NHS and helped with the relief during particularly the first wave of COVID. And also those did continue to run services in the community and allowed the continuity of care for patients that really needed it at that time, who wouldn't have otherwise been able to get any help or any input. Moving on to the challenges. So, like everyone, in almost every sector, there is clearly a workforce challenge. Okay, I won't touch on it too much because I'll come to it in my solutions. There is also, we're seeing an increase in demand and increase in complexity of presentations that are coming to private practice. Now, that could be for numerous reasons, but we can see this demand happening. Now, I've got 2 bits of data on this. Without being a PR agency, you can't do a deep dive on this, but it's somewhat indicative of what's going on. The top 2 searches there are for chiropractor and osteopath, which are majority private practice services. So we know that at least from searches, the demand exists to access or at least learn more about what these professions have to offer. We can also see the trend over time. So this goes back to 2004 when this data started being collected, and you can see there a steady increase in all 3 of those professions that I've included on this graph, with a particular takeoff around 2011 and chiropractic and osteopathy hitting their peaks pretty recently. You can also see the impact of the pandemic on there with the huge drop off in search volumes and the trends there, but with a good recovery, I'm pleased to say. So demand over time is also picking up. What are some more of the challenges? There's a widely held concern across private practice for patients without the means to access care. Now that's in 3 ways: financial means, being able to pay for care; accessibility, not having services locally to them; or the agency, so that the knowledge of how to navigate the system and find people appropriately. And I'm hoping to address the solutions to this point in the final section of the presentation. We also have the challenge of access to diagnostics and other secondary care services. So rheumatology would be a fantastic example where we've identified the need for that. Our only way to get people back into that system is through primary care front door, through GPs. And that obviously is not helpful for anybody. It slows down things for us, and it adds to the workload of primary care. Now, unfortunately, this is one of the only challenges at this time that I'm unable to offer you a solution for. I am sorry about that. The other one is how patients find and verify these private practice services. Now, this is perhaps where there's some work for us at professional bodies to do to improve this. But we are seeing the emerging challenge, let's say, of how these services are advertised and promoted, and on the whole, pretty poorly enforced regulation and advertising standards. And that is something that needs to change. And I know the PSA are looking at that, thankfully. We're also starting to see the issue of social proof emerging, particularly among younger patients, where social following on social media sites is conflated with efficacy or competency of treatment, which of course is ludicrous. So we need to do something about that. And again, solutions. The other big one, and statisticians, please don't come for me on this one. This was a poll across social media. So I ran this on LinkedIn, specific forums on Facebook and on Twitter. As you can see, a fair number of votes there, but actually 74% of private practitioners don't feel valued by NHS colleagues and leaders. So do we have a cultural issue here with how the two sectors coexist, how we communicate and how we work together? Now, personally, I feel valued, but I'm in the privileged position where I get to speak to lots of people in the public sector. So if we had a team member on a local level, boots on the ground, didn't feel valued, we'd be looking at something to address that problem, looking at the culture and coming up with a plan, a communications plan of how we were going to improve that, improve the dynamic so that we could ultimately deliver the best care to patients. We need to do this on a systematic level. We need to make private practitioners feel valued. Comms is hard, but it's really important. And we need to do that piece, because at least if we don't implement any practical changes to how the system works, which is the kind of blue sky thinking piece, we need to at least get everybody communicating better, understanding each other and back on the same page, and hopefully make more people feel valued. Solutions. Here we go. So you can see the 4 words that I've included in there up at the top: culture, respect, understanding, and communication. And these were words that consistently came up when I was speaking with colleagues about the content of this presentation, of things that needed to, of things that were central to solutions and things changing and getting better. So they're my 4 words, and I'm just going to leave them. In terms of addressing the workforce challenge, this is the easy one, the low-hanging fruit, the competency-based recruitment. It's easy because it's already happening. It's happening at the entry level for clinical positions with the introduction of MSK clinicians by some trusts. And of course, it's happening with first contact practitioners. It simply involves widening the talent pool for positions, putting the best person in for the job, and having the best person in front of the patient. And of course, getting the right skill mix in the MDT for whatever your MSK service is. And private sector can do that, public sector can do that. It can happen across the board. We also need collaborative upskilling. So again, this comes down to communication and understanding and working together. If we identify a need to improve education or standards of treatment for a particular condition or area of MSK, then let's work together as a public and private sector to collaboratively upskill the workforce and bring up the level, share the educational pieces, and ultimately improve that patient care. And that's how we're going to get rid of some of the unwanted variation in practice standards as well in private practice. Okay, we need to collaboratively upskill, and there's a really good example with NAS and the AXPAR campaign around how we might be able to do that. What else can we do? Well, we can introduce some flexibility in commissioning. So this is where we start to take on the issue of those without the means to access care. And this is an issue really close to my heart. Preaching to the converted, if you talk to me about this as the MD of a social enterprise, but this is really, really important. Okay, now AQP wasn't necessarily widely loved. Okay, this was input from colleagues of mine. I don't really have any experience of it myself. What there is appetite for a reformed version or a new version where we utilize and we harness the facilities, the community locations, the expertise and the capacity of private practice. And just like all other services in the NHS, we make it free at the point of use, and we do that through commissioning. ICSs next year offer us the opportunity to do this on a local level where it's needed, and to really use up that capacity. Now, in terms of implementing that, way above my pay scale, I'm happy to input, as I know other professional body colleagues are. But clearly, we need to do something to make services equitable across the board, and we need to make it work for everybody. Okay, the biggest piece, how am I doing for time? Yeah, I've got time. The biggest piece is signposting. And this came up in every single conversation I had as a solution to how we can work better together. We can take on numerous issues here. We can take on capacity, we can take on the advertising, the social proof. We can give patients agency to navigate the private sector where they have the will and the means in order to do so. If we have a resource that provides appropriate education and signposting around MSK conditions and where to find a practitioner and what to look for when you're seeking out that care, patients can take that information and add it to the ways in which they would already go and seek out these services. And hopefully that will be a big step to them accessing effective and safe services in the private sector. And that signposting is really important. We need to give patients the agency to do that. Those that then do have the means and the will to access these services in the private sector can go ahead and do so. And we free up the capacity in primary and secondary care for those people who really need it, because they're either more complex or they don't have the means. A final thought before we move on to some questions, because I do want to take the questions on, and I'd like people to challenge my opinions as well. But those of us with the privilege of influence must not allow ourselves to be constrained by the system that we currently work within, or the bureaucracy that exists. Rather, we must acknowledge that we are the ones who can change it for the betterment of the patients it serves and the people that work in it. We have a private sector system that isn't going anywhere. We have a public sector system that exists. We can work together better. And those of us on this call today are the ones who can change it. So that's my call to action to those of you listening. In terms of questions, there's my contact details. You can get me by any of those means. If you do want to have a slightly longer argument with me, you can scan the QR code and book in a meeting. I'd also like to bring your attention to the ARMA Private Practice Group, which has been just the most incredible source of support over the last 2 years. Has been wonderfully brought together by Sue and Nita. We meet on a regular basis to discuss issues in our sector, and we're more than happy to work with any stakeholders who are keen to work better together, to communicate and to improve the provision for MSK services in the community. That's everything from me. Jane, I'm happy to do any questions.
Thanks very much, Ollie. That was really interesting and probably challenging for many people. In the interest of time, we've got very little time because I know we have to pass on quite quickly, but I'd like to put Rob's question to you, if I may. Rob has put forward the question about, we're already in a situation where we're trying to integrate lots of different MSK pathways. We've got issues with patient record sharing and so many different providers and pathways. How does adding even more providers into a local NHS pathway help this and help the joined up system? How do you get around that?
Well, that's the challenge, isn't it? Technology is clearly a big part of it, and setting expectations is clearly a big part of it. I mean, Rob, that probably is the biggest challenge in terms of actually using this private sector provision. But I think if what we're going to do is make things better for patients, because ultimately that's the goal, we need to find a way to make it work. You know, it'd be that introducing a standard form of reporting that the private sector use for collecting data, for reporting back on outcomes, and for feeding that information back into the public sector, then so be it. Technology can make that happen. We just need to find a way. If you want to chat, we'll chat at the networking session, because you've probably got some ideas around that as well, if you're posing the question to me.
Okay, one or two people have responded to that, Ollie. So I'm going to leave it there because it's 3:20 and I've been asked to keep to time. But if you can be in the networking session, great. I expect that people will have quite a few questions. I know I've written a couple of questions for you, so I'll be there holding you to account here. Thanks so much for that.
Pleasure.
Really interesting talk. And I'm going to pass you over now to Sue,